Hello everyone. Today is the first class under module 1 of healthcare innovation and entrepreneurship. In this module we will be covering few points. Under that we can say the number 1 is the overview of healthcare industry landscape in India and as well as in international scale. Next is understanding the need for innovation and entrepreneurship in healthcare. Third is case studies of successful healthcare innovation and startups. Fourth, introduction to design thinking and its application in healthcare innovation. Fifth, ethical consideration in healthcare entrepreneurship. So, as said, the number 1 point is the overview of healthcare industry landscape. So, moving on to the next slide, we will be getting the first slide of our first topic, that is global healthcare landscape. Firstly, when we talk about global healthcare landscape, the healthcare sector plays a pivotal role in ensuring the well-being of population. It includes hospitals, pharmaceuticals, diagnostics, medical equipment, health insurance, and digital health services. The global and Indian healthcare landscapes have been significant transformation in recent years due to technological advances, changing demographics, and increased public awareness, and especially the artificial intelligence. So, firstly, as I said, we will be learning about both the international scale as well as the national scale. When we will be discussing about the international scale, the first thing that is coming to our mind is the market size of the whole global healthcare landscape is valued at over USD 8 trillion globally. That means 8 trillion USD dollars. Next is growth drivers. The factors that drives the growth of the healthcare landscape are: number 1, the aging population; 2 is rising chronic diseases, and mostly the digital technologies and the advanced technologies that is coming day by day and is also affecting the healthcare industry. Next is adoption of artificial intelligence, robotics, and telemedicine, expansion of digital health services, growth of medical tourism. These three are the major points that can be considered as the trends of this healthcare landscape. Now, the leading countries, that means the countries that are leading the global healthcare industry, that are USA. USA is leading because of its advanced healthcare and high expenditure. Number 2 is Germany or UK. It is leading because of its universal healthcare. Number 3 is China. It is increasing because of its rapid infrastructure development. Without infrastructure, nothing is possible. So, because of that, China is developing its healthcare industry very fast. And once the infrastructure is done, this advanced healthcare systems and high expenditure is helping USA to grow its own market. So, moving on to the next slide. Next slide is Indian healthcare landscape. Firstly, the Indian healthcare landscape in structure, we are dividing into two parts, that is the public healthcare and the private sectors. In the public sector, government hospitals and health missions are coming, and under the private sector, corporate hospitals like Apollo, Fortis, Manipal, these multi-speciality and super speciality hospitals are being included. The key statistics that can be said is health sector to reach in India 638 billion US dollars by 2030, and the doctor to population ratio is 1 is to 834. And also the government expenditure, which is very important, at least in the landscape of the Indian population, because without government expenditure nothing is possible, where it is seen that approximately 2.1% of the whole GDP is being allotted for the healthcare industry from the part of the government. Government initiatives like Ayushman Bharat, that is PMJY, public health insurance scheme, and the National Digital Health Mission is integrating the health with the advanced innovation and the technologies. For obvious reasons, when we are talking about this global and the Indian healthcare landscapes, the major differences that is seen is the health expenditure, right? How much the amount of GDP, how much of the GDP is being spent for this healthcare. In India, it is seen to be 2.1%, and in the global landscape, the average is approximately 9 to 10%, which is huge and which is a major difference from India and the other global states who dominating the healthcare industry. The insurance coverage in India is approximately 37%. That means 37% of the Indian population are having these healthcare insurances. But if we see in the international landscape, it is seen that mostly 85% and more population are consuming this healthcare insurance, or we can say is health insurance. And in recent times it is becoming mandatory in the countries outside India, at least in the developing countries and the developed countries, that the health insurance is becoming a mandatory part of their lifestyle. And the doctor population ratio in India, it is 1 is to 834, and in the international landscape it is 1 is to 1000. Next, if we talk about the challenges that is faced by the Indian healthcare landscape, that is India is facing, number one is unequal rural-urban access. The major thing is, a major part of India still comes under the rural population, and as much as the urban population is getting the advancements, is getting the opportunity for advanced healthcare, the rural population are not getting so, whereas all these digital transformations are being done, because so that the rural people can avail those advanced healthcare technologies and can lead their life very easily without any hassle in terms of the healthcare. But it is seen that there still remains a very unusual and unequal gap in the rural urban access of the healthcare. The next challenge is shortage of healthcare personnel, which is another deficit that is seen in India. As we have already seen in the doctor patient ratio, it's 1 is to 834, which is insane in if we compare it with the international level. So insufficient amount of doctors, nurses and the management staffs are being seen in the Indian healthcare landscape. The third challenge that can be highlight is high out of pocket expenses. New healthcare trends are coming, new technologies are coming, this telemedicine, artificial intelligence incorporation with the healthcare, as well as the telesurgeries, telemedicine booths, online pharmacies. These things India is adapting day by day, but the main problem that is coming in the way of adoption of technology is high expense. The expense is becoming so much, the expenditure of money is becoming so much that most of the people are unable to do so. So the main goal should be to reduce the amount of money, so that everyone can avail the advancements that is being indulged in the industry right away. The opportunities that can be seen, number one is growth of telemedicine, as already discussed. As I already said, that telemedicine and digital platforms are increasing, but it's coming with a little bit more price than usual. So the main motto would be to reduce the price and to increase these kinds of opportunities. The next opportunity is investment in affordable medical devices. As I said, the medical devices should be affordable enough, because a major part of India is still coming under the rural population, and if we talk about rural population, the income level is not as much as high as the urban ones. And the third one is expansion of insurance and the health infrastructure. The insurance, the health insurance, as many countries are doing it as a mandatory factor in India, that should also be incorporated. And a strong infrastructure is very very needed, as because without strong infrastructure nothing is possible. In the next class, we will be talking about the understanding the need for innovation and the entrepreneurship in healthcare. So, thank you.